At first, pain before death doesn't sound different from the pain you've felt 1,000 times before. A stubbed toe, a pulled muscle, a stomach cramp that passes. But when life nears its end, pain transforms. It stops being a signal to protect you and becomes a punishment your body can't escape. From crushing trauma to the suffocating burn of organ failure, every system in your body can turn into a source of agony. And the last type, the one you won't believe, shows just how far pain can push the human body. Let's walk through the main types of pain people feel before death, from the bearable to the unbearable. Type 1. Trauma pain. This is the most immediate and obvious form of pain before death. Car crashes, falls from height, explosions, or battlefield wounds all produce trauma pain. Broken bones grind together. Muscles tear apart, skin rips open. In major accidents, survivors describe sensations like fire spreading through the body or knives stabbing from the inside out. One paramedic recalled pulling a man from a collapsed building who screamed until his voice broke, not because of one injury, but because dozens of fractures, bruises, and lacerations all competed for the same nerves. Trauma pain is overwhelming, not precise. It floods the body in seconds, leaving people writhing, gasping, or frozen in shock. And if the injuries are severe enough, then the nervous system can stay locked in that state until death comes. Doctors who work in emergency rooms often say that trauma patients rarely stay quiet. If you see silence, it's either unconsciousness or death itself. Type 2. Ischemic pain. When blood flow stops, pain begins. Ischemic pain happens when tissues starve of oxygen, like during a heart attack, stroke, or blocked artery. People often describe it as crushing, squeezing, or tearing from the inside. It is not sharp like a knife, but heavy, as if an iron weight is pressing down on the chest or skull. Heart attack patients sometimes say it feels like an elephant sitting on their chest. Stroke patients may describe sudden exploding headaches followed by numbness and collapse. Ischemic pain can kill quickly, but in those minutes before unconsciousness, it is among the most suffocating forms of suffering. The scariest part is how fast it escalates. One moment you're breathing normally, the next, you're clutching your chest, overwhelmed by a pain that feels endless. Many victims never even reach a hospital. Type 3. Visceral pain. Visceral pain comes from the organs deep in the body, the stomach, liver, intestines, or pancreas. This pain is often described as dull, twisting, or burning, but its intensity can climb to unbearable. A perforated bowel or ruptured appendix spreads acid and waste into the abdominal cavity, causing agony with every breath. Doctors remember patients doubled over, clutching their stomachs, unable to move without screaming. Unlike surface pain, visceral pain radiates. You can't point to a spot. It feels like your whole torso is on fire. It grows with each breath, each cough, each tiny shift of position. For many, it becomes unbearable long before death actually arrives, creating a drawn-out spiral of agony that nothing seems to stop. Type 4. Neuropathic pain. Neuropathic pain doesn't come from wounds or broken bones. It comes from the nerves themselves misfiring. As death approaches through conditions like late-stage diabetes, spinal cord injury, or advanced infections, nerves can spark constant electrical storms. Patients describe it as lightning bolts, stabbing ice picks, or fire under the skin. One woman dying of multiple sclerosis said every touch, even a blanket, felt like broken glass dragged across her body. Unlike trauma or visceral pain, neuropathic pain often doesn't fade with position changes or rest. It's relentless, and because it comes from the nervous system itself, it is notoriously difficult to treat. Even morphine sometimes does nothing, leaving patients trapped in a storm of signals their brain cannot shut off. It is pain without injury, agony without wound, pure suffering generated from within. Type 5. Bone and cancer pain. Cancer that spreads to the bone is among the most documented agonies before death. Tumors press against nerves, fracture bone from the inside, and release chemicals that amplify pain signals. Patients describe deep, drilling pain that doesn't let up day or night. Movement makes it worse, but stillness doesn't help. One hospice nurse recalled a man with spinal cancer who begged to be kept sedated until the end, because every attempt to shift in bed felt like being broken in half. Bone pain is primal, heavy, and constant. It doesn't fade. It only escalates until the body can no longer fight. Researchers studying cancer patients note that even with advanced medication, bone pain is one of the hardest to control, and often the one families remember most vividly when describing their loved one's final days. Type 6. Inflammatory pain. When the immune system goes into overdrive, it can turn the entire body into a source of pain. Sepsis, the body's overwhelming response to infection, causes joints, muscles, and skin to ache, as inflammatory chemicals flood the bloodstream. This is not one injury. It is the body attacking itself from all directions. Patients often develop burning skin, throbbing muscles, and a deep flu-like ache that becomes impossible to ignore. Doctors describe sepsis patients who wince at even the lightest touch, as if every nerve is raw. Inflammatory pain drains strength and hope long before it kills. In advanced stages, patients often shake with chills while simultaneously burning with fever, every nerve firing at once. The confusion and delirium of sepsis only magnify the sense of suffering, until patients often don't know if they are dying from infection or from the sheer weight of the pain. Type 7. Respiratory pain. Few sensations are more terrifying than the pain of not being able to breathe. Respiratory pain comes from drowning, suffocation, lung disease, or fluid filling the lungs in conditions like pneumonia. It is not just shortness of breath, it is actual burning, cramping, and tearing as the body fights for oxygen. Survivors of near drowning describe it as fire in the chest, with every breath feeling both too little and too late. In the final stages of lung failure, patients often feel as though they are suffocating slowly while fully conscious. Doctors call it air hunger, and it is one of the most primal and horrifying pains a human can endure. It creates panic layered on top of agony, a body screaming for oxygen it can't obtain. This is why palliative doctors often focus most heavily on controlling air hunger, because it is the one sensation that can strip away every ounce of human dignity in the final hours. Type 8 renal and gallstone pain. Kidneys and gallbladders can cause agony that drives people to collapse. Kidney stones tear their way through urinary tracts, while gallstones block ducts and trigger sharp, stabbing abdominal pain. Near death, when these organs shut down entirely, the pain often spikes to levels patients describe as intolerable. One man with advanced kidney failure described it as razor blades twisting inside me. Gallbladder ruptures, left untreated, flood the abdomen with bile and infection, layering visceral pain with systemic collapse. These are pains that don't kill immediately, but leave patients begging for any form of relief until organ failure finishes the job. Doctors in palliative care often prioritize these pains aggressively because unmanaged, they leave patients thrashing, unable to rest, and unable to find peace even in their final days. Type 9. Burn pain. Burns are one of the most studied forms of pain at the edge of death. Even after nerves in the skin are destroyed, surrounding tissue keeps firing signals of agony. Third-degree burns covering large areas cause searing pain combined with fluid loss and shock. Doctors recall patients screaming continuously in the first hours after severe burns, sometimes fainting, waking, and screaming again. Painkillers rarely erase it, only unconsciousness provides relief. In large-scale fires or explosions, burn pain is one of the clearest examples of how unbearable suffering can accompany dying. What makes it worse is that burns don't just hurt once. They continue to hurt during treatment, as skin is cleaned, as wounds are dressed, as the body struggles to repair itself. Survivors often say the pain never truly goes away, even decades later, proving that burn pain is one of the most unforgettable tortures the body can endure. Type 10. Neurological and headache pain. Not all lethal pain comes from the body. Some comes from the brain itself. Massive hemorrhages, meningitis, or infections in the brain lining cause splitting headaches that drive patients to delirium. Cluster headaches, often called the worst pain known to medicine, can also occur near the end in patients with neurological disease. Descriptions range from a red-hot poker behind the eye to my skull being crushed from the inside. Unlike migraines, these headaches often come in waves, striking again and again without warning. For patients already weakened by illness, neurological pain is the final assault on consciousness itself. Doctors in neurology wards sometimes describe patients pounding their fists into walls or begging for unconsciousness just to escape the torment. When the brain itself turns into a source of pain, there is no distraction, no escape, only the pure raw experience of agony that eclipses everything else. Type 11. Multi-organ failure pain. When multiple organs fail at once, kidneys, liver, lungs, and heart, pain is no longer localized. It becomes total. Muscles cramp from electrolyte imbalances. Joints ache from toxins. The chest burns from fluid overload, and the abdomen twists from liver swelling. Doctors in intensive care units describe these patients as restless, agitated, and unable to find any position that doesn't hurt. Every system screams at once, and the brain cannot separate one pain from another. It is the body's ultimate breakdown, and the suffering matches its scale. Some patients become delirious, thrashing against restraints, while others withdraw completely, their bodies shaking with every labored breath. Multi-organ failure is not a single pain, but an orchestra of agony, playing until the body can no longer carry the tune. Type 12. Terminal agony. The final type of pain before death is what doctors sometimes call terminal agony. At this point, pain is no longer protective or even meaningful. It is constant, overwhelming, and untreatable. End-stage cancer patients, burn victims, or trauma survivors sometimes reach this stage despite the strongest medications. They cry out, writhe, or beg for relief that never comes. Families often describe the helplessness of watching a loved one consumed entirely by pain until the body finally collapses. Terminal agony ends only when the nervous system itself fails, when shock, coma, or death silences the signals. Until then, it is the most extreme suffering a human can experience. Doctors rarely talk about it openly, but in private, many admit this is the part of medicine they dread the most, because even all their tools cannot end the torment. Pain begins as a gift, a signal to pull your hand from the fire or rest a broken ankle. But before death, pain stops saving you. It disables, tortures, and consumes until nothing else remains. From crushing trauma to suffocating air hunger, from nerve lightening to burning skin, every type of pain before death reveals the same truth. The body has limits. Push it too far, and pain doesn't just warn you, it becomes you. And the last type, the one beyond belief, shows how much suffering a human body can carry before it finally breaks, until the very last breath, when silence finally replaces the scream.